To start a consultation with patients who want a COVID-19 antibody or antigen test, pharmacists will first have to search for their patient to double-check they have not already registered on the Pharma Doctor eTool system. In this case, there is no existing record, so the pharmacist should register a new patient by filling in all the general patient information required in the eTool. They then need to select COVID-19 testing service from the available consultation options. Before proceeding, pharmacists have a chance to double-check the registered general patient information before moving on to the questionnaire. Here the pharmacist has to indicate which type of test the patient wants, in this case an antibody test. All fields are required as the information gathered is important for ongoing COVID-19 disease surveillance. The pharmacist has to provide professional, responsible advice to explain to the patient the purpose and limitations of the test they're about to receive. This will include a clear explanation that a positive test result does not mean they are immune to COVID-19. They should also make it clear that regardless of the test result, the patient should continue following government advice on social distancing and self-isolate if appropriate. Once explained, the pharmacist needs to check the patient is understood and is happy to proceed. The eTool will then display the tests available to select. To give consent for the selected product, the patient can sign a printed form, enter their password or give verbal consent. The pharmacist then confirms they have provided all relevant responsible advice to the patient and confirms their consent by entering their account password. Once the pharmacist has given the patient the test result and explained it to them, they will have to add the test result to be stored on the eTool record. Please note, in the case of the antigen test, the sample needs to be sent to a lab for analysis before the result is returned, so the pharmacist would have to exit the consultation at this stage, then come back to add the test result once available.